Pfizer said Monday that its 3-shot vaccine regimen was 80% effective in kids 6 months to 4 years old. This is according to an early analysis of the trial. And this comes as children ages 5 to 11 are now eligible for a COVID booster. On Thursday, the Center for Disease Control and Prevention cleared kids to receive booster shots of the Pfizer biotech COVID-19 vaccine. This comes as COVID cases are on the rise across the U.S., specifically the Omicron subvariant BA2.
In February, researchers from the New York State Health Department reported that 2 doses of the Pfizer vaccine offered 12% protection against infection for children 5 to 11 during the Omicron wave, though the CDC found it did still protect against severe illness. And of course, severe illness is the important thing we're trying to prevent against. Clearly, the vaccines have, even if they have maybe they're protective for a short while, or they offer some protection against infection, they are not at all even close to offering the sort of broad-based, long-lasting protection that we hoped from protection from infection. But they still do, prevent the most vulnerable from having severe disease, and that's great. But children are not really in the severe disease category to begin with, unless they have other health issues, severe obesity, things of that nature. And I absolutely think families should be able to make that choice, for their kids, with their kids' consultation for themselves. But it's just, I certainly don't want to see any mandates on children. I think it'd be insane for schools to require this sort of thing for young kids with, absent much evidence that they're significantly at risk.
Well, and that's what they do plan to do. They do plan to use this to mandate.
That's crazy.
We're already seeing that. We're seeing that even for preschools. They're waiting for the vaccine to come out for young children so that they can then mandate it for the kids going into preschool. My biggest issue with this, with the booster for the 5 to 11-year-olds is, for one, they didn't really run any clinical trial data on this. They don't have much to go off of. They said, well, we showed that it raised antibody levels, but then they couldn't show for how long it raised antibody levels. They really couldn't show that it really did protect against, even when they say, well, we show it protects against severe disease, the data is extremely flimsy. There's really not a lot to go off of. And it's because children are not really high risk. So the sample size would have to be so much larger than what they used in order for them to show any sort of benefit, because kids are so low risk of any sort of negative outcome. And because they couldn't really do that, they used other measurements, and it wasn't up to the same levels that they used for like elderly adults, for example. But they do not know how long this booster actually lasts. That's why the New York data says, well, we're only like 12% effective against Omicron. Now, by the way, we're in Omicron subvariant, so it would be even less effective theoretically. But, and then they don't even know also the long-term side effects of this vaccine for the young kids. So it's kind of that cost-benefit analysis has not been done.
So am I to understand that this newest vaccine has 80% efficacy in what? Not ending transmission, but preventing severe illness?
Right.
Okay. And can you tell me a little bit more about what mumblings there have been about mandating vaccines for children? I confess not to have been following it as closely. Are there schools that have said that they anticipate that when the vaccines come, they are going to mandate, or is this something that we're kind of talking about in a hypothetical way?
No, there are schools that have said. I mean, it's not necessarily, governments aren't necessarily saying it yet, that they're going to mandate it. I mean, maybe like here in Los Angeles.
There were school districts in California that had planned to mandate it, and then maybe I think they changed course, right? Because so many families were like, hell no.
Against
right?
it, yeah. So it's a lot of preschools, which are privately run, they're discussing it. So we're seeing it on kind of an individual, like locality, or even just like an individual private preschool sort of basis at this point for that. But, when they say that it's 80% effective, you have to really parse through the data. They just don't. The effectiveness, again, children have such low risk of any sort of negative COVID outcome that the data that they're giving is extremely flimsy. And I could do, maybe I'll do like a real extensive radar on this to kind of break down the actual clinical trial data, because the clinical trials were basically either non-existent or extremely flimsy, like 140 kids or even 1,500 kids, which is just not enough to show anything. And they would say, well, some got the sniffles and then others got the sniffles too, but the unvaccinated ones got the sniffles and the vaccinated ones got the sniffles, but the vaccinated ones showed an antibody response. So it's therefore effective because they had an antibody response. I
wanted to point this out because I retweeted this. So this fact was reported in the New York Times this week that 4,000 children aged 5 to 11 have died from a COVID-related condition called MultiSystem inflammatory syndrome during the pandemic. That was wrong. They've corrected it. An earlier version of this article incorrectly referred to the numbers of children aged 5 to 11 with multisystem inflammatory syndrome. About 4,000 have been diagnosed, not died.
Oh.
That was in the New York Times. They reported 4,000 child deaths from this, 4,000 diagnoses.
Right. And again, we do know that the vaccine does cause, for example, myocarditis in the larger doses for the older kids. And so that's why they've held off on giving the younger kids the big, heavy doses. They give them a really small dose in comparison. And then they say, well, now it turns out that the reason why the vaccine's not as effective in those 5 to 11-year-olds is because they're getting that tiny dose. So then what's the solution? And then they say also against the new variant. So it's the tiny dose in combination with the new variant, making it less effective. But again, they don't even have the data to say that it's really less effective. They just don't have the large enough sample size. There's just so much wrong with the clinical trial data with the young kids. And a lot of it, I just have to say, is a lot of pressure from parents and teachers unions. They just really want, they just believe still like the vaccine's going to be the end all be all and save everybody. I don't know why they believe that when in adults it hasn't worked for that, to end the pandemic. People are still getting COVID. Obviously, it's great for older people, preventing severe outcomes for people in those severe outcome categories. But children, young people, young adults are not in those categories. I agree with you, Robby. I think it should be a parent's choice. My biggest issue with this right now is the CDC is recommending the booster for 5 to 11-year-olds. They're not saying it's available to you if you want it, which I think would be maybe a more appropriate for parents that do have immunocompromised kids. They're instead saying we recommend it for 5 to 11-year-olds.
Especially because the reality has been if the CDC recommends something, then all right-thinking people have to do that. It's not no longer, it's not voluntary. It's if the CDC says it, it's not just it's supposed to just be guidance, just advice. Well, this is what we think, but you set your own policies, but you've been considered a deranged person or rogue entity or decision maker if you don't do exactly what the CDC tells you to do and then some and then more caution.
Yeah, and then right now the trend is there's a big push from people saying, well, the lack of clinical trial data is the same as the lack of clinical trial data for seatbelt safety, for example. So we still mandate kids wear seatbelts, even though we never really ran proper clinical trials on that. So therefore, it's fine to recommend or even mandate these boosters when we don't have the clinical trial data for it. I mean, there's a lot of flaws in that argument. Seatbelts are like an obvious benefit. I think that is outside of your body. It's not something you have to put into your body. You wear it for the duration of the car ride, right? And then there's just a lot of flaws, I think, to those kinds of arguments. But that's kind of the trendy argument.
You know what I'm going to say, right? I see
no
Briahna
seatbelt
rolling
laws. That there shouldn't even be seatbelt laws.
Yeah, that is what I was going to say. All right, let's wrap this up. Tomorrow on Rising, maybe I'll talk about my views on seatbelt laws, or we'll dive into microchip shortages, inflation, and more with journalist Eddie Alderman.
And we'll continue to bring you updates on the tragedy in Uvalde.
Be sure to like, share, and subscribe so you never miss any content. And for those of you who like to listen while on the go, we're now available anywhere you listen to podcasts. Be sure to check us out. Oh, look at all of us. Look at, they've changed it. There's so many of us.
They got you in there, Bri.
Yeah, they got you in there. Wow.
All right, we look like a fun party now, or a moderately fun party.
I think we're actually a really awesome party. People don't realize when we all get
Ryan is
together,
bringing most of the hardcore fun vibe.
Ryan actually Ryan's a riot to be around at a party.
Why are you guys doing this to him?
He loves when we bully him.
Poor Ryan. We love you, Ryan.
All right, we'll see you next time, guys.
Bye-bye.
Bye-bye.